we need to be concerned by the rise of this particular variant, but it's not time to panic yet. Why do I say that? We do know that during this particular pandemic, no different than what we've seen in HIV infection over many decades, what we've seen for influenza even longer, that viruses continue to change themselves so that they can grow better in the human host and so that they can escape the immune defenses that we have or that we develop with products like vaccines. So it's not a surprise that we continue to see the virus throwing these kinds of variants at us. So there's two things that we're beginning to learn about Omicron. One is how well it transmits from one person to the other. Two is whether or not it's going to be a challenge to the current vaccines, monoclonal antibodies, or the drugs that we're just beginning to develop. And the honest truth is, as of today, we really don't have those answers. This particular virus, when we look at its genetic makeup, is a little scary because it looks like it has the kind of features that we would expect to be associated with it being better able to transmit and being more able to avoid the vaccines and monoclonal antibodies that we've developed. But that's just a guess. We really need a couple more weeks to do the tests in the laboratory to look at these kinds of questions and then to develop the observations that we'll do worldwide, looking at people that have been vaccinated with any one of the number of vaccines that are being used worldwide to see if this is becoming a problem.
It's interesting because the Netherlands said that the Omicron could have been in the country even prior to South Africa identifying it. What is your reaction to that? And what does this mean in terms of what we know now about Omicron?
In my view, once you detect a virus in 10 or 15 countries, it's probably it's probably everywhere. And then tracing back to where it started is going to take time. Just because you're the country that first detects it doesn't mean that you're the country where it came from. It may just be because you're so darn good at detection. I can tell you Botswana and the Republic of South Africa are very good at doing this. They're better than a lot of countries. I know that's been an issue in the press about being basically victimized by having, been efficient at detecting the virus, right? But the bottom line is we really just don't know where it came from. At the end of the day, where it came from is far less important than what are we going to do about it. I could tell you the critical things are we've got to get the world community vaccinated for people that can take vaccines, using other modalities where people can't get vaccines, continue to wear masks.
Moderna and other companies are working to develop a variant-specific vaccine, if you will. Are we looking at adapting vaccines in the future? Because when we saw Delta, I don't remember a variant-specific vaccine was developed.
You raise a great point. After Alpha, Beta became the really scary one, right? It was scary because it looked like in all the experiments we were doing, it looked like Beta was going to be a real challenge to current vaccines. And so Sanofi Pasteur is actually right now, as we speak, doing a second phase 3 study where it's looking, and it has the ancestral virus, but it has a second component, which is the beta virus. Beta has a lot of the same features as Omicron. Companies are not just already preparing. One company is already testing a vaccine against a pretty related kind of a virus right now. So you have all that in play. But if you remember, Beta, as scary as it was, got completely spanked by Delta. Now, Delta was not as much of a threat by any means to the vaccines, but it grew in humans better. That really is the key. It's that pressure between viruses that grow in us better and then transmit better, and all of a sudden to replace the older viruses. Beta was so scary that one of the monoclonal antibodies that we were using in the United States could not be used anymore for about 2 months. Then Delta came in, pushed Beta aside. Then that monoclonal antibody was actually good against Delta. So now it came back into use. We have to be flexible.
How can a vaccine like that work?
So I can tell you just in general, this is the way vaccine developers are working for vaccines against HIV, which is a lot more mutatable than coronavirus will ever be. Even though we're talking about the virus can mutate, there are parts of the virus that it really can't change, because if it does, it kills itself. So what our challenge is to try to make a vaccine that covers that part of the virus that really can't change. There are a lot of us that are working right now, and the science is well established for going after those parts of the virus that don't change as much. Or you come up with, instead of having a single vaccine type, you have maybe 2 or 3. That's done right now for influenza. If you look at a standard influenza vaccine, it's got 4 components. It goes after 4 kinds of variants. I think the future is pretty bright, honestly, for us switching from one bug and one drug to go from that, which is really not so great, to go up to a place where we have one drug that gets all the bugs. And that's the kind of research that our group and a number of other groups around the world are working very hard on.